To the fight against COVID-19. Tonight, an ER nurse in Portland is begging everyone to help ease ER capacity.
They're asking you not to go to the hospital if you have mild symptoms of COVID-19. Fox 4's Connor McCarthy is live outside of Legacy Health in Northwest Portland, where they echoed that plea today. Connor?
Yeah, that's right, Wayne. And Nora, Legacy Health put out a statement yesterday asking the public not to go to their emergency room or other ERs around the Portland area looking for a COVID-19 test. I talked to John Seeley. He is an ER nurse in the Portland area. Now, he didn't disclose where he worked, but he says that his hospital is seeing an influx of patients with mild COVID-19 symptoms. Now, this is putting a strain on his staff because it's inhibiting their ability to help others who actually need emergency care. As Omicron spreads and Oregon breaks daily case numbers, hospital ER departments are getting overwhelmed, but with patients showing mild symptoms looking for a COVID test.
I wish I could show you a picture without breaking HIPAA of just what the waiting room looks like, of where it's busting at the gills.
John Seeley says this rush of people is adding more stress to an already understaffed hospital.
It's not the appropriate place is the emergency department, and I understand not wanting to wait 3 or 4 days for either your doctor's office or the expo center, but unfortunately it just puts a huge burden on an emergency department.
This also leaves other patients who need emergency care at even greater risk of being exposed to the virus. Seeley says he understands the anxiety around getting COVID-19. He says many with mild symptoms don't know where to go.
I can't explain in great enough detail of how hard it is to continually just see large numbers of patients and also know that there's not much you're going to be able to do for them in regards to time, and then that's making people frustrated at wait times.
Seeley says there needs to be more conversations about how to treat COVID at home for cases that aren't serious.
Omicron, it's going to make you nauseous. It's not going to make you feel well. You're going to be tired. So the things that you can mitigate that are just the simple remedies that sometimes when you're sick and you're nervous about COVID, you kind of forget about, with that Tylenol water and, just getting plenty of rest.
Seeley says this will help ER departments from getting overwhelmed.
Saying not to come to the hospital is not kind of innate to us if you don't feel good, but I think we do need to have a better conversation of what to do with your symptoms, and if you go over this tipping point of whatever, I don't want to be the one that decides what that line is, but whatever that tipping point is, that's when you come into the emergency department and see us.
And Seeley and Legacy Health are asking the public to contact your primary care doctor if you do have mild COVID-19 symptoms, so you can get a test. Now, legally, everyone that walks in through an ER door has to get help from, doctors and nurses in there. But he says that, at his hospital, they're discharging about 80% of patients that walk in with COVID-19 symptoms. Live in Northwest Portland, Connor McCarthy, Fox 12 Oregon.